Hi there and welcome. As a senior pelvic floor physiotherapist, I spend my days helping women with health issues that are, well, often really hard to talk about. So today, we're going to tackle one of them openly and clearly. And I want to start this explainer with a very direct and very personal question. So, does that question hit home? If the answer is yes, or even just sometimes, I really want you to hear this. You've found a safe space. I mean, it's supposed to be this peak moment of pleasure, right? So when there's pain instead, it can feel so incredibly isolating and confusing. So many women face this in silence, but you really, truly don't have to. This right here, this is a feeling we hear all the time in our clinic. The emotional toll of a painful orgasm is it's huge. It can create so much anxiety, it can strain relationships, and it can really knock your confidence. So if you feel this way, please know your feelings are completely valid and you are so understood. Okay, so here's the most important thing I want you to take away today. What you're experiencing is actually pretty common. It's not normal, but it's common. And, this is the big one, it is almost always treatable. The very first step is just understanding what's going on in your body, and that's exactly what we're going to do right now. All right, let's get into it. To really solve a problem, we first need to give it a name and get what's happening on a physical level. This isn't some vague symptom you're imagining. It's a real, recognized medical condition. And that medical term is dysorgasmia. It's really just a catch-all for a whole range of uncomfortable sensations, pain, pressure, burning, cramping, that show up right when you should be feeling pleasure. Just giving it a name is so powerful. It helps take it from feeling like some sort of personal failure to what it actually is, a medical issue we can fix. Do any of these sound familiar to you? Maybe you notice a deep cramping, kind of like period pain, or a burning sensation. Maybe it's an ache deep in your rectum or tailbone. For some women, it's the sharp shooting pain, and for others, it's this awful throbbing that can stick around for minutes or even hours after it's all over. These are all clues. These are all signs of dysorgasmia. So let's talk about why this happens. And I really need you to hear this. It is almost never just in your head. This isn't something you're making up. There is a real physical reason for what you're feeling. Probably the biggest contributor we see is the state of your pelvic floor muscles. Think about it. An orgasm is a series of really fast, rhythmic muscle contractions. But if your pelvic floor is already tense, all tight and guarded, those contractions aren't going to feel good. They're going to feel like painful spasms. Our entire goal is to help your body move from that tense state on the left to that relaxed, coordinated state on the right. Now, a tight pelvic floor often doesn't just happen on its own. It can be connected to other conditions like endometriosis or fibroids. It could be due to an irritated nerve or major hormonal shifts like after having a baby or during menopause. Sometimes it's scar tissue from a C-section or another surgery. That's why a really thorough assessment is so important. We have to find the actual root cause. Now, to really understand just how not alone you are in this, let's zoom out and look at the bigger picture for a second. Dysorgasmia is often one piece of a much larger puzzle called chronic pelvic pain, and that affects at least 15% of women around the world. I mean, that's a huge number. So while your pain feels very personal, your experience is shared. This isn't some rare, isolated issue. It's a major part of women's health that absolutely deserves and has effective treatments. Okay, so we've talked about the what and the why. Now let's get to the best part, the how. How can a specialized pelvic physiotherapist actually help retrain your body and get you back on the path to pleasure? While our approach is really comprehensive, and it's always built around you, we start with a gentle assessment to figure out exactly where the pain is coming from. Then we use hands-on therapy to release tight muscles. We have strategies to calm down those sensitive nerves, and we use tools like biofeedback and breath work to help you literally reconnect with your pelvic floor and learn how to relax it. And honestly, education is everything. We want to empower you with the knowledge to manage this for the long run. And I have to address a really common fear right now. A lot of women worry that if they have pelvic pain, the treatment for it is also going to be painful. Let me just put that fear to rest. Our therapy is always, always guided by your comfort. The whole point is relief. A session should feel good and leave you feeling better, not worse. So, we've walked through the problem and the solution. Now let's talk about your path forward. Because recovery is not just a vague hope, it's absolutely possible. And it all starts with taking one simple, brave first step. This right here is the most powerful thing I can tell you. And it's not just my opinion, it's based on clinical evidence and years of experience. With the right help, the vast majority of women see a huge reduction in pain or it goes away completely. A future where intimacy is something you look forward to, something joyful instead of feared. That's a realistic goal. I want you to just let that sink in for a minute. This isn't some luxury or an indulgence, it's a fundamental part of your health and your quality of life. You deserve to experience pleasure without pain. You deserve to feel confident and safe in your own body. You deserve to enjoy intimacy. And taking that first step, it's actually really simple. If any of this today resonated with you, please don't try to figure this out all by yourself. A private, confidential assessment is the start of your journey back to feeling good. You can just scan this code right here to book an appointment with a specialist who gets it. Thank you so much for taking this time for yourself today.